inviting me. I want to thank the Peaceful Planet Foundation for having me today, and thank you for coming. It's great to be able to talk to people about something I'm passionate about. And I picked this topic because I am an OB-GYN who subspecialized in maternal fetal medicine, which is high-risk obstetrics. And so I've been treating women for over 30 years now in my specialty. And so one of the things you learn over time is it's not so much about the little things, it's more about the bigger picture and taking a step back sometimes. And one of the things I've learned is women get really passionate about making changes before they get pregnant, to get pregnant, and while they're pregnant. And I believe it's because most women want to leave a legacy. And for many women, part of their legacy, if not the most important part, is having a family. So I want to talk today about the impact of women and what you can do to have a healthy family. I'll be talking a lot about the early stages of life, but a lot of the principles I talk about today really apply at all stages of life. In fact, personally, I was a meat eater until I was 50. And I learned about the whole food plant-based diet because I started studying nutrition. As the docs know in the audience, we don't get nutrition in medical school, at least we didn't when we were going through. And I was studying what would be the best lifestyle for the rest of my life to keep me healthy, prevent osteoporosis, breast cancer, because it runs in my family, etc. And that's how I got involved in this. But now I'm interested also in spreading the news to my patients. So before I start talking about women, I want to talk about this guy. This guy is Carl Taylor. You probably never met him. I had the opportunity to hear him a few years ago at a conference. But basically, he's the father of public health in this country. He was the chair of the Department of International Medicine at Johns Hopkins. He started many years ago and had a long life. He traveled to over 70 countries studying the impact of public health on communities. And so one of the things he discovered that's apropos to today's talk is the impact of women in healthcare. And one of the things he found out was that women can, in action groups, solve the majority of their family health problems. Isn't that remarkable? Yes. He said, at the conference I went to, he said, women are the most underutilized resource in communities. So irrespective, again, of where you are in your life, whether you're planning on having babies or already had them all of this applies because we all have a role to play. So I'm going to focus on three basic areas. One is preconceptual chronic disease and pregnancy outcomes and how we can reverse some of those effects, epigenetics and fetal programming, and also the impact of nutrition on pregnancy and childhood. So one of the things I see every day in the office, because I do a lot of consultations on women, many of whom are wanting to get pregnant, many of whom are either infertile or have many chronic diseases. And I see a lot of younger patients, as the other docs have mentioned, with a lot of these chronic diseases. I see teenagers with chronic hypertension, type 2 diabetes, super obesity, which is when you have a BMI greater than 50. So all of these are very common. This is just a small, short list of the things I see, all of which have a negative impact on pregnancy. And I don't have time to talk about every single one, so I'm going to focus on the most common one that I see. The most common disease that OB-GYNs see every day in their practice is obesity. And as was previously mentioned, 2 out of 3 adults are either obese or overweight in this country, and 1 out of 3 kids is. In pregnant women, 36% of pregnant women are obese, and about 3% are super obese. That means they have a BMI greater than 50. And unfortunately, there's a disproportionate number of African American women and Hispanic women that are obese. In fact, I think it's 56% of obese women during pregnancy are African American. So this is a very common scenario we see. We see a woman who is obese, and we see their children who are also obese. So what are some of the impacts of obesity on pregnancy? Well, number one, it causes infertility. It also increases the miscarriage rate. It leads to hypertension and a pregnancy disease called preeclampsia, which is hypertension in pregnancy where there's also protein in the urine. The only cure is delivery, and I've had to deliver people at 20 or 22 weeks when the baby's not viable because they get preeclampsia. And it's a highly inflammatory disease, as you'll see in a minute. Gestational diabetes, DVTs, or blood clots. It increases the cesarean rate because they have bigger babies. It increases the anesthesia risk, especially if they have sleep apnea. Increases their risk of failed labor, and also increases the risk of ICU admission. In fact, the ICU admission for obese women ranges anywhere from 1% to 6%. And it's about 6% for super obese women, which is a BMI greater than 50. What are the fetal risks? Most people don't know that obese women have an increased risk for birth defects. They have an increased risk for preterm delivery. That's usually because of other comorbidities such as high blood pressure, diabetes, preeclampsia that occurs that causes us to deliver the baby earlier. There's an increased risk for birth weight, which increases the risk for birth trauma, which means injury at the time of delivery. That also includes cesarean section deliveries, because if the baby's so big they have to pull hard, you can actually do permanent nerve damage. And the stillbirth rates increase with a BMI greater than 40. What are some of the childhood risks? Well, there's an increased risk for obesity in the children. There's also an increased risk for metabolic syndrome, such as type 2 diabetes. And there's an increased association between developmental delay, autism, and ADHD. So, what do we do about that? Well, one of the things I talk to patients about is changing their lifestyle and reducing their weight. If we can reduce the BMI to less than 30, then we can reduce the morbidities or complications that we see during pregnancy. So both the American College of Obstetrics and Gynecology, as well as the World Health Organization, the Institute of Medicine, recommend that we get a healthy weight, at least to a BMI less than 30, to reduce pregnancy complications. And I know this slide is busy, but basically what it's trying to say is the best time to take control of your health is before you have a family, because you can prevent and reverse a lot of these problems. Getting to a healthy weight is helpful, and as we'll see in a minute, you can not only reduce your risk for a morbidity or problems, but you can also reduce the risks to your children. And we do this through a whole food, plant-based diet. And I know the other docs have talked about this a lot, so I'm going to not go into the details of this, but this is really the way to approach this problem for the most part. Now, I mentioned epigenetic programs, so has Dr. Bukhari and Dr. Chawla. And most of you might think, well, if a mother's obese, well, of course their children might be obese because they might be feeding the same things they're eating. So of course their baby's going to be obese. But what I want to explain or help to explain is that there are changes that occur during pregnancy that actually pre-program the cells for future diseases. Just taking the example of maternal obesity, the epigenetic changes that occur, and epigenetics is really the science of the impact of external or environmental factors on the expression of genes. So think of it this way. You have electricity coming into your homes, but you control the switch as to whether or not the lights come on or off. And we can do the same thing with diet. Just one of the more amazing, beautiful things about food is that you can reverse these changes pretty quickly. So the obesity itself causes an alteration in nutrient transport across cells. It's also inflammatory and lipotoxicity. It also affects the microbiome of the neonate, and so does milk composition affect the microbiome of the neonate, and I'll get to that in a minute. But the bottom line is obesity, or what we're eating, which leads to obesity, can program your metabolism for increased risk for adiposity, which means increased fat cells, and cardiometabolic risk factors. So the pre-programming that occurs, for example, would be an increased number of fat cells. So if you have an increased number of fat cells, if you overeat, it's much harder to maintain your weight. And so one of the biggest gifts you can give your children is to change how you eat when you're pregnant, or preferably before you get pregnant. Here's another cartoon that talks about epigenetics. Again, there's external factors such as what happens during pregnancy, chemicals, drugs, aging, and diet. But diet is one of the easiest things we can manipulate or change. It causes what we call a methyl group to be attached to part of the genome that affects how genes are expressed. And whether or not that methyl group is there or not is affected by the types of foods we eat. The more plants we eat, the better, more healthy expression of the genes. The worse we eat, the increased risk, there's an increased risk for cancer, autoimmune disease, mental disorders, diabetes, to name just a few. So again, the whole point is we can turn on or turn off those genes just with food. What are some studies that show this to be true? Well, one of the more common ones that's quoted is the Dutch potato famine. I don't know if you heard of it. When the Nazis invaded the Netherlands during the 1940s, they took all the cattle with them. So it was a kind of a natural experience in a year of not eating meat. They mainly had potatoes to subsist on. Most of the women ate less than 1,000 calories, the pregnant women ate less than 1,000 calories a day. And they had smaller babies, and they produced children with an increased glucose tolerance, obesity, heart disease, and breast cancer. So it actually occurs on either end of the spectrum. If your baby's too small or if your baby's too big, you increase the risk for all these morbidities. But this was kind of a longitudinal study that actually proved that what you do or what you eat during pregnancy does have an impact. Well, there was another study that was done not that long ago that looked at high protein and low carbohydrate. Sound familiar? That's the new fad diets. Well, even after controlling for the mom's blood pressure, her weight, and smoking, adult children 40 years later had an increased risk for hypertension. Isn't that remarkable? Just by what they ate. Another study, and I did not talk to Dr. Bukhari before this, so I had no idea what he was going to talk about, but he mentioned that there's been studies done in Vietnam vets who died on the field, and they looked at fatty streaks in their aortas and other large vessels. And more recently, we've seen it in children and adolescents. Well, I came across a study that actually shows that women who eat high cholesterol during pregnancy, the babies that they lose, like for example, they're born before they're viable, they looked at the aortas, which is the large vessel that comes out of the heart. And they saw a direct correlation between increased cholesterol, which equals meat or fish, and fatty streak formation. That's amazing to me, that you can actually prevent your babies from getting cardiovascular disease just by changing what you eat. And another study, and this was just one group that looked at low-fat vegan. There were 775 women in that group. All were pregnant. Only 0.1%, which is roughly 1 out of 1,000, got preeclampsia, whereas the normal incidence among women who eat the standard American diet is 2 to 8%. And most of you might think, again, okay, big deal, preeclampsia. But it is a big deal because when you're delivering people at 24 weeks and then they have a baby in the nursery, that's a big expense. It's also a big stressor. And there are some women that still die from preeclampsia. So again, to prevent it by using food is really ideal. And we literally are what we eat. So what we eat during the pregnancy affects the risk of disease, both in childhood and later in adulthood. So if you want to have a healthy pregnancy, focus on eating plants. Again, whole food, plant-based diet, consisting of fruit, vegetables, beans, whole grains, nuts, and seeds. And Dr. Chawla mentioned this. This was a statement of the Academy of Nutrition and Dietetics, because a lot of women will go, well, is this safe during pregnancy? Yes. This study came out 10 years ago. Whole food plant-based diet is safe for all stages of life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adulthood, and for athletes. Here's some examples. Another question I get is, well, is the baby going to get enough protein? Well, yeah, you get 8 to 12% protein eating whole food plant-based diet. Some of the biggest Contributors are your beans and your whole grains. They get all the vitamins they need. If you go exclusively plant-based, you'll need to supplement B12, but that's really all you need. And if you eat a variety of plants, you'll get all the nutrients both for you and baby. Another benefit is the high fiber. Two of the most common complaints I get is constipation and hemorrhoids, all of which can be avoided with a high fiber diet. Most people go, oh, well, does that mean I should take Metamucil? I said, try eating more plants. You know, yes, you can take Metamucil, but it's not as good as eating plants. So again, the model pregnant woman is eating mostly plants. Another way that you can help your baby is breastfeeding. Most of what women are taught is, oh, well, you're going to pass good antibodies over to your baby, reduce the risk for sickness, etc. But one of the things that we've learned recently is that you actually positively affect the microbiome by breastfeeding. Why? As I'll show you in just a second. But the studies have shown that if the kids are bottle fed, they're more likely to have an abnormal microbiome during childhood, and that increases the risk for obesity. So I have a question for you. What period in life do humans grow the fastest? Any guesses? In utero, also the first year of life, they double in size. First year of life, babies double in size. What amount of protein do you think you need to see that rate of growth? This is the components of breast milk, most of which is water, but look at what nutrient is there the most. Lactose is sugar, carbohydrate. Fat is, there are omega-3 fatty acids, but almost 4%. You need less than 1% protein to double the size of a baby in the first year of life. This is a period of natural or biologic veganism, if you will. And it is a way that I try and talk to people about, you know, when they talk to me about the protein levels or in percentages, I said, well, you can double a baby's size in a year with less than 1% protein. Why are you afraid to go to 8 to 12% protein? You're not going to wither away. You might lose some weight, but you're actually going to become healthy. So this is something that you can use to explain to people why this is safe to do, and in fact is healthy to do. And you're doing your baby a big favor. In fact, the pediatricians recommend at least 6 months of exclusive breastfeeding, and the longer you can go, the better it is as far as future health. As your children get older, you have an opportunity to influence them. Do they want to eat the apple, or do we want to eat the eclair? Kids need help understanding these things because they too are going to school, or unfortunately our schools don't serve healthy food. We can't be around them 24 hours a day. It's really about modeling it at home and then teaching them so they can be plant strong. Another interesting thing is studies have looked at the impact of teaching children how to cook or get involved in meal preparation. And as it turns out, the more involved they get in designing what it is they're going to eat and pulling in what foods they're going to eat, the more likely you're going to choose vegetables and fruit and other healthy foods. They actually start asking for broccoli, which is really interesting because when I took my certificate from the E. Cornell, the T. Colin Campbell Institute a few years back, this is one of the studies that we got to read. It was really fascinating. And kids, as I have a friend in Dallas, and she's always trying to disguise healthy food. She's not completely plant-based, but one of the things she does, she makes this wonderful romesco sauce for spaghetti, and she roasts all these wonderful vegetables, including tomatoes, and throws them in a blender. And her kids love it, but she has to disguise the vegetables sometimes just to get them to be interested in it. But even being overt in it has really been shown to be helpful. So again, eat the rainbow. You've heard that 3 times this morning already, at least, or maybe 4. And to close again with Carl Taylor, he had a very long career. In the last year of his life, or next to last year of his life, when he was age 92, he was in a bamboo hut in northeast India, and he asked the women, He said, how do you want to shape your future? And the women answered, it is the empowerment of ourselves. So hopefully I've inspired you as women to go be influential with yourself, taking care of yourself, influencing your family, and hopefully friends and relatives. Thank you.